everyone. I put together this video so I could introduce myself. My name is Lindsay and I'm a registered dental hygienist. I am new to the Family Dental Center team, which I'm very happy to be a part of, and I look forward to meeting you all when you come in for your dental appointments. So as a health professional, educating our patients and clients is a big part of my job and the Family Dental Center team's job. So that's why we put together a slideshow on x-rays. So if you guys could take a look and let us know what you think. If you have any questions at all, please don't hesitate to ask, and I look forward to meeting you when you guys come in. This is a routine bite wing x-ray that we take approximately every 2 years on most patients. You can clearly see the decay on this tooth in the middle of the image. It's a large cavity that has grown into the pulp chamber. If this bite wing x-ray was taken regularly, then we could have caught it sooner and did a smaller filling. This cavity resulted in a large filling and a root canal. This is a periapical x-ray showing the top 2 front teeth. This patient had no pain. However, the patient may have lost the tooth if we did not find this. This is a chronic infection, again with no pain. The black circle is an infection that is eating away at the root tip and bone surrounding the tooth. That's the one circled in red. Note the green line, which is the shape of the root on a healthy tooth. If nothing is done, this young patient will have to look at often expensive options to replace the missing front tooth. This is a panoramic or pan x-ray for a 10-year-old girl. Please note the adult teeth that are developing on the patient's right side compared to the patient's left side. The left side shows the adult canine, which is like your eye tooth or your corner tooth, will be trapped, and the tooth in the blue is erupting in the wrong direction, which is the premolar. Early treatment can help the future adult teeth erupt in the correct position. If nothing is done, the left canine may not erupt at all. This is the same image that you just saw, but without the markups, so that you can properly visualize where the teeth are growing. Ceph x-rays taken for orthodontics show us more than just teeth. We can also assess airway. We take an airway-driven approach to treatment in addition to common orthodontic care, which when complete, result in better sleep, breathing, and facial appearance. A common analogy to help us understand this concept is to consider whether you'd want a straw as your airway or a garden hose. The previous slides showed just a few examples of dental x-rays and what we can diagnose with their help. In very rare cases, we might even catch life-threatening problems, like a tumor, before symptoms show up. This saves valuable time in treating the issue. There are plenty of other scenarios when dental x-rays are needed. Please don't hesitate to ask for an explanation if you're unclear as to why we are electing to take them or what we have found on your recent x-rays. This image is from the Canadian Nuclear Safety Commission. It just compares and shows different radiation exposures from things in your everyday life, from flights across Canada to natural background radiation exposure. The dental x-ray is on the lower left of the screen, and you can see that it's considerably low. We're also super excited because as of 2019, our office is now fully operating with modern ultra-sensitive digital equipment, which means that very little radiation is actually needed to take the x-rays. Plus, we also have far more flexibility with the x-rays that we do take, like altering the shades or exposure for more precise identification of problems. So, to sum things up, we recognize your concerns regarding radiation exposure when it comes to taking x-rays. We want you to feel comfortable knowing that we use our professional judgment in determining whether and when they are necessary for you. When x-rays are prescribed, we have deemed that the risk of missing a diagnosis or problem is greater than the risk of taking the x-ray, which, as you learned in the previous slide, is quite low. Ultimately, our hope for all our patients is that these routine x-rays show us 0 problems at all. And the good news is, the fewer times we detect problems on your x-rays, the less frequent the dentist needs to prescribe them for you.